Hi, I'm Dr. Michael Taggart with the Kirkland Health Institute, where we focus on specializing in helping people overcome chronic health conditions. This video today is about how to get relief from chronic knee pain. Now, there are many people that believe that if you have knee pain or thinning cartilage or bone on bone, that there's nothing else that you can do other than joint replacement surgery. The good news is that's no longer true. There's always advances in healthcare. We're learning new things, there's new techniques, and there are now breakthrough therapies that can help you get relief from your chronic knee pain condition even if you have bone on bone. So it's also important to understand that knee replacement surgery doesn't always work. It's a complex, invasive surgery, and there can be complications such as infection, months of rehab, missed time from work. Also, the cost of the surgery could be prohibitive, and also since it's an artificial joint, it's going to wear out in 10 to 15 years, so depending on your age, you may be a candidate for a second surgery. The key important factor to get rid of your chronic knee pain condition is to address all of the different components that have caused your knee to wear out. It's very important to understand that your knee does not work in isolation with the rest of your body. All of your joints above the knee, below the knee, all the ankle, the hip, the low back, they all work in conjunction, including the muscle systems and the nervous system, all work in conjunction to allow your knee to function the way it's supposed to. So if you're still having knee pain, what that means is that those mechanisms have not been working well for a long time. For instance, if you have a weakened arch one side of your body, that's going to put more stress on the knee when you stand, walk, or run. So you really need to ask yourself, why is it that my right knee is giving out but my left knee is relatively okay? Or if you have two bad knees, why do you have two bad knees but your shoulder joints are okay? See, the point is all these joints are the same age, so it's not just the aging process. So the reason that you have the chronic knee condition is you've not been to any doctors who have been able to thoroughly evaluate and address all the components of why your knee joint is wearing out. There are basically four main things that we have to look at in order for you to get recovery. We have to look at, first, we have to do a comprehensive knee pain evaluation, including muscular evaluation. We're going to evaluate all the muscles that support the knee, including the foot and the hip. And we're going to evaluate those muscles with manual muscle testing to see if there's any strength problems there. We're also going to look at those same muscles with a palpatory evaluation. We're going to look for sore spots around those muscles, all those muscles and those tendons. And I can guarantee if you have a chronic knee pain condition, we're going to find a lot of soreness. Now, when that soreness is there, what that means is that you've got spasm in those muscles, you've got inflammation, scar tissue, and adhesions. And that's occurred because of old injuries that you've had and trauma and stress that you've had in your body over many years, and it's affecting the muscles. Now, we're going to check the four muscles of the foot, and we're going to check the important muscles of the knee, like the back of the knee, the popliteus muscle, which helps your knee rotate right and left when you walk. We're going to check the tensor fasciae lata muscle, which is a lateral knee stabilizer. We're also going to check the hamstrings, the glutes, all the muscles of the feet. So it's a very comprehensive muscular evaluation that we're going to do. Now let's talk about bone-on-bone problems. So this is my attempt at drawing a knee. So we have the femur here, we have the tibia, this is the fibula here. So in this case this would be a left knee. We got the patella or the kneecap here. So when we have a bone-on-bone situation, we tend to have a bow-legged situation. On the left side here, we tend to have an open joint, and these muscles tend to be weak, so we have to strengthen these joints. Or not these joints, but we have to strengthen these muscles. On this side where we have little to no joint space, these muscles tend to be tight, so it's important that we lengthen these muscles to get that knee working. So it's very important in this situation that we do that muscle therapy in order to get results. Now the second thing that we have to do is we have to do comprehensive joint evaluation for mobility for the joints above and below the knee. This is going to include the ankle, the hip, the low back, etc. to make sure all those joints are working properly, and also the nerves that make those joints are also working properly so the brain can send that information to those body parts. The third thing that we need to do is we need to check what's called the large diameter sensory nerves in the lower extremity. Now your body has mechanisms in the spinal cord and the brain that turn off pain. If we're not getting enough sensory input from the ankles and the feet and the lower extremity into the spinal cord, it's not going to turn off pain. And that could be a contributing factor of why your pain won't go away. So how we evaluate that is we take a tuning fork and we strike the tuning fork and we test the vibratory sense of the patient. Now, if everything's working okay in the upper extremity, it should feel even on both sides. We'd say that's a 10. Then we strike the vibratory tuning fork, and then we check the feet. Now, if one side's like a 2 or a 3 or the other side's a 5, that means that those nerves are weakening, and that's not going to give enough input into the spinal cord, and it's going to perpetuate pain. So if that's the case, we have to do rehabilitation on those nerves. Now, this is an exam that you've probably never had, even if you've been to a specialist for knee problems. The next thing we need to do is we need to do a metabolic evaluation if it's involved in your case. Now, here's what's interesting, is that your body uses sulfur to detoxify your body. So if you have high blood sugar, any type of other inflammatory condition, it can be aggravating the knee and other joints, and when you have high levels of toxicity, it's going to take the sulfur out of your cartilage and you're going to use it for detoxification. So as a result of a metabolic problem, you can get a knee problem. So we may have to evaluate that as well. So when people come into my office, it's not just because of the knee pain. It's what they're no longer able to do as a result of the problem. You can't play golf anymore. There's certain sports you can't participate in. You can't hike. You can't go on a walk with your friends or your spouse anymore. As a result of inactivity, you also may be gaining weight. So with our program, we want to improve the function of the knee to the point where you can start enjoying those activities again and getting your life back. We're going to use advanced therapies to address all those factors, including muscle lengthening and strengthening techniques that we talked about, cutting-edge techniques. We're also going to evaluate all the joints and remobilize those dysfunctional joints, including the knee and all the joints above and below. We're also going to do neurological therapies on the large diameter afferent nerves if we need to, and we're also going to assess you metabolic if it's necessary. We're also going to use something called cold laser therapy, which is a new cutting-edge technique that speeds healing in the body. Some of the things that cold laser therapy can do is it can stimulate endorphin production. That's your natural pain blocking mechanism in the body. It also is going to suppress inflammation, which is going to decrease swelling and pain and redness in the body. It's also going to improve lymphatic drainage, which speeds healing and increases circulation. It's also going to release tight muscles, which can be creating chronic pain and decrease mobility. And it's also going to help your bones heal faster by stimulating bone growth. So with these cutting-edge therapies, I expect results in 1 to 2 visits. People comment how surprisingly fast they feel better. Now, because you're feeling better in a short period of time doesn't mean that your program doesn't need to go on longer than that, because once you start getting relief, we need to transition to a rehabilitative phase of care so the problem doesn't come back again. If you're interested in eliminating or greatly reducing your knee pain without the toxic side effects of medication and invasiveness of surgery, give our office a call at 425-821-1101 and ask about our comprehensive knee pain examination for $49. It's a great value. In fact, we are so confident that if we can accept you into a program that we're going to be able to help you, is we're going to give you 2 free visits so that you can test drive the program so that you can see the results for yourself. So I'm going to highly encourage you to call our office. I would really enjoy seeing you get your knee pain condition handled so that you can start enjoying life again. I hope you've enjoyed this video, and I look forward to meeting you soon.